What I can say about how I feel about what has happened is that there has been a real social injustice that has played through. It didn't need to be like this.
For months, hidden away from view, coronavirus has rampaged through Britain's care homes.
People could have lived for the next 2, 3, 4, 5 years. It took them too early.
Only now is a full testing system beginning to take shape, but it comes too late for many.
An empty chair, another empty chair. Where is this disease that nobody can see?
They promised us testing, and that has been on the news every day, day in, day out.
We've lived through the crisis with the charity MHA in Blackpool, Burnley and beyond. They're the largest charitable provider of care homes in the country. By the end of this, around 1 in 10 of their residents will have died. Many others will recover.
They've agreed to share with us their journey through this crisis. This is the inside story of what happens when a silent killer infiltrates your care homes.
The aim of today is to talk about the importance of washing our hands, okay? Which is something that we all do all the time. As we know about the coronavirus, it's very, very important that we uphold those policies and procedures.
It's early March. At Pennstone Court in Blackpool and across MHA's 90 homes, they've been preparing for the possible arrival of coronavirus for a month already.
Yeah, see that, Margaret? Then you want to turn your hands over and go right up the fingers.
Well, I just get hold of them and go like that.
Lisa manages this home of 36 residents and 45 staff.
Pennstone Court's a feeling. You have to go into Pennstone Court to know, but it's a very, very special place to me. Partly because of the team. They're just so wonderful, committed, resilient.
You could have sat. I love the job because I can be there for them. It's that sense of giving them that love and that care. I'm very passionate about what I do.
Now rub it in your palm like that.
I'm frightened, but I console myself that at 88 years of age, you haven't got long to go anyway, so it don't matter.
You look super healthy. I think you've probably got a long time to go. I
hope
you do.
You've got a lot of life to live. I wouldn't say I was frightened, more concerned of to what effect it would have.
I think I thought this is a worry. This is something that we have to try and prepare for, but that essentially we'll be fine because we're a good home, we follow excellent infection control procedures.
No, there's an easy, really, really easy way. Just sing Happy Birthday twice.
Yeah, shall we do it?
Happy birthday to you.
It was all very much the unknown.
At the point when Newsnight first visited Pennstone Court, nobody in Blackpool had died of the disease. Only around 300 people had tested positive nationally.
We will give some very specific advice on care homes, but one of the things we're keen to avoid is doing things too early.
Back then, the limited guidance that was in place in England was that there was no community transmission at that point, and people in care homes were unlikely to become infected. That message became highly controversial. At the time, at another MHA home, Heather Grange in Burnley, the idea it wouldn't threaten life there was a comfort.
There was some reassurance out there that, you know, it was all going to be controlled and it wasn't coming our way and etc, etc, and so we took some stock in that really. But in the background made some preparations to think about that.
We could see what the advice was saying, but we were erring on the side of major caution because we couldn't see how this wasn't going to hit, and if it got in, then the potential was huge.
Ten days before the UK went into lockdown, the virus reached an MHA home, Avonlea Gardens in Oldham, when the first resident fell ill with coronavirus symptoms.
Because I know Avonlea Gardens and I know the staff, I know the manager very well, it was a shock. And my fear was, how was it going to spread? what could we do to prevent it as an organisation, and what would the government think, going to do at that stage about testing our residents, etc.
There is this feeling of the water's breached the sandbags. We kind of paused and thought, OK, we've crossed the line. This is real.
Ready, steady, go!
Back then, the authorities weren't advising care staff to wear masks routinely. Across the homes, life was continuing as normal. Behind the scenes, the focus was increasingly on planning MHA's response to the virus. Just 2 days after the first case, there was even worse news. With the virus appearing in other homes, the charity was starting to log its confirmed or suspected cases. The next grim milestone was at Westbury Grange in Buckinghamshire, when the first resident died with COVID-19. It was a complete surprise after a routine test while in hospital. In his prime, John Simpson had helped found the Open University. 91 when he died, his family described him as simply irreplaceable. The home went on to lose 11 more residents to the virus. Only 5 had access to a test.
A few died in hospital, most here in the home, with some relatives choosing to go inside wearing full PPE for a few precious moments to say their farewells, while others took the heartbreaking decision to say goodbye through the window. The toll on staff, too, has been heavy.
They take people through to end of life on an ongoing basis. That's what care homes do, but not at that pace and not in those circumstances where you've got somebody, the wife of one gentleman standing outside the window with a phone and her spraying some perfume onto a cloth to put under her husband's nose.
In Blackpool, with the virus apparently getting closer, Pennston Court's Marcina was increasingly realising it wasn't only residents who were at risk.
My son, he is 10 years old and he's called Raheem. He's absolutely amazing boy. Very proud of him.
Marcina relies on her parents for childcare. She began to plan, if the virus reached her care home, that Raheem would have to move in with them to protect them all.
Biggest fear is loss, because I knew there would be a massive risk of me catching COVID-19 because of the environment I'm in. And he was very understanding. He was scared. He would say to me, I'm worried that you get it.
On the 17th of March, MHA took the decision to close all their 90 homes to the outside world. Residents in homes with outbreaks were shielding in their rooms. The next day, it established an emergency team or Gold Command to respond to the unfolding crisis. One of its first tasks was to take a charity-wide decision on a policy that even then was contentious. Because on the 19th of March, the government began what it termed the safe and rapid discharge of those people who no longer need to be in a hospital bed. Most would go home, it said, but care homes would be paid to take a very small proportion. It later made clear negative tests for COVID-19 are not required prior to transfers or admissions into the care home.
My managers were challenging the hospitals. They were challenging and saying, we're not taking anybody who's not had a test. And this was going back and two, well, you'll have to do because we need the beds. And we were saying we're not, because we, don't want to introduce COVID-19 into our care homes. And it was an absolute battle at the very beginning.
I was talking to one of my managers last week, and she said that it had got so difficult in terms of this discharge process that what she would find is hospital wards were ringing up in the evening, the care home, and saying that the manager had agreed to somebody being discharged from the hospital, and the person had enough about them who was on duty at night at the care home to ring the manager and say, I'm surprised about this, but have you agreed? And the manager would say no, they hadn't. And so there was a huge amount of pressure clearly in the NHS to clear beds, but there were some practices going on to put pressure on to homes to take people, which was just completely inappropriate.
MHA had refused to accept hospital discharges without a negative test. Some managers did take back a small number of their own residents who'd been hospitalised. Meanwhile, the virus was creeping its way into more homes. At the top of Gold Command, views were crystallising about the one thing they really needed: routine tests in care homes for all staff and residents.
I think it's very difficult not to see that the only real way that this can have come into our homes is through staff picking it up and not being particularly symptomatic, or being in the very early stages before they develop symptoms, just through the community contacts that those people would have had. I look back and I struggle to see why we didn't adopt a strategy that was being adopted elsewhere in the world of testing, tracking and tracing, and that we seemed to fly in the face of that without any real rationale or reason. I can only convey to you the immense frustration at a local level and then at a national level, trying to agitate to get what you knew was going to enable you to better manage infection control in our homes.
From this evening, I must give the British people a very simple instruction. You must stay at home.
A week after MHA locked down its care homes to all visitors, the nation was catching up. And the worst was starting at Heather Grange in Burnley. MHA data shared with Newsnight captures the charity's log of cases. Without routine testing, many were never confirmed formally as COVID-19. Heather Grange was one of the first MHA homes to experience an outbreak.
We got the virus sort of really early doors. We'd got a number of residents who became unwell really, really quickly. All the advice out there was to keep an eye out for high temperatures and a cough. Well, some of our residents didn't present with high temperatures and a cough. Some presented with no symptoms at all and went straight from being okay to actually having quite severe breathing difficulties and needed hospital care. What we'd got in our heads from the information we were given from policy and government and such was, this is what you expect to see. That wasn't quite what we saw, and pretty frightening for the staff as well.
Heather Grange was home to 57 residents, many living with dementia. The virus ripped through in 2 weeks. 10 residents died.
It was relentless. We'd seen cases where people had literally showed some symptoms on a Friday, and by Tuesday they'd passed away. Maybe 1, 2, 3 people passing away in a day. So residents that had several more years of happy life in front of them became very frail very, very quickly. It was devastating to watch. It was scary to watch.
It was still early days in the UK's response to the virus. Mark's residents only got tested if they went into hospital. Most didn't get that far. Initially, there'd been a drive to protect NHS beds. Other residents had opted for their care to be managed in the place they knew as home.
How much testing was going on for you?
None. There was no testing.
Were you asking for it?
Yeah, I actually had a conversation with Public Health England at one stage and asked for tests, and I was categorically told that there was no testing for care homes in the northwest. We were on our own. As a care home, we had the support of our company, who were doing everything they could. But in terms of wider public services and government, we were isolated.
Testing for care homes wasn't just a problem for MHA in the northwest of England. And without the confirmation testing would have offered, we may never fully know how many people died in UK care homes. As the Heather Grange outbreak accelerated, the Prime Minister was pressed on why care homes weren't getting enough testing or PPE.
Can the Prime Minister tell the House, in the 80,000 care homes around Britain, what date will they expect tests to be carried out on the day that symptoms emerge, and every single person working in those care homes will get the protective equipment they need?
Well, on the tests, as I said earlier on, the answer is we want to roll that out as soon as we possibly can, and on the personal protective equipment, the answer is by the end of this week.
Did that happen?
No. If we had relied on and had to rely upon the government supply chain now, We would have run out of PPE 3-4 weeks ago.
Andrew White heads up MHA's procurement team. In normal times, care homes buy their PPE for staff on the open market. But with such high demand, that was drying up. The government opened up NHS supplies to the sector. Even so, MHA was constantly moving PPE between homes. It was hard work, but they never ran out.
The consequences of that would have been horrendous. It would have meant staff not going into work. It would have meant a lot of more staff contracting COVID. It would have meant more residents dying. It would have just been an uncontrollable fire within the care homes. It would have just swept through.
The government pipeline has kept faltering. It's been inconsistent and it's been inadequate. We normally spend around £500,000 or £600,000 on PPE every year. The last 8 weeks we've spent 1.5 million.
The list of homes with suspected or confirmed cases was growing, and at Burnley's Heather Grange came another devastating milestone. Lynn Chadwick was the first MHA staff member to die.
This is the coffee bar at Heather Grange, where Lynn worked, and also at one stage became our PPE station whilst we were managing through the virus. It was particularly devastating when Lynn passed away. She knew all the families, she knew all the residents, she'd paint nails and she'd chit-chat about old times and talk to families, and she was just a very, very reassuring presence to a lot of people.
Lynn was 57, 2 weeks away from her 30th wedding anniversary, a mother and doting grandmother. Where she picked up the virus may never be established, but we do know care workers are twice as likely to die in this pandemic as the rest of us.
She had, in essence, died of pneumonia, but with coronavirus. Some people were inconsolable. Some people were very quietly reflecting on it, because it really brought it home to the staff team what we were dealing with. It wasn't just we're caring for these people who are really poorly anymore. Actually, this could be life-threatening for themselves.
Lynn had been such a part of Heather Grange and Mark's home, and just to hear Mark talk about how he was responding to it and how he was putting his arms around his team, it made you hugely proud.
Data given to Newsnight shows most of MHA's symptomatic residents living in these homes never got a test. But by early April, the charity had recorded 100 deaths of residents to COVID-19.
On the 10th of April, when we could count our first 100 people who had died in our homes, then by the 17th to have reached 200, and by the 24th of April to have reached 300, was a feeling of being subject to something that you were desperately trying to manage but were really struggling to contain.
From the moment of the emergence of coronavirus, we've known that some of the most vulnerable to this disease are in social care, and we've been taking action right from the start.
Nearly a month after lockdown, and a month after MHA's first death, the government announced its long-awaited action plan for social care. The Health Secretary also made promises on testing.
We'll test all symptomatic care home residents, and as I announced last Friday, we've introduced testing for all social care colleagues and members of their households who need a test. We needed that back around the 15th of March, in the run-up to the lockdown on the 23rd of March. It was too late, a month too late. Lynn passed away, we had residents pass away and the families. That could have changed the outcome for people. That early warning, that testing could have changed outcomes for people.
As the awful news has started to come out of care homes about what's been going on, I've thought a lot about the people we met in Blackpool, just really hoping against hope that they can keep coronavirus out of that home. But we have just had some bad news.
Coronavirus was continuing its creep across the MHA estate. And in mid-April, an outbreak began at Pennstone Court when a resident tested positive in hospital.
It was myself that took the call. I'm the COVID coordinator within the home. I think my heart sank that it had. Although in the back of my mind we always knew we were going to be at risk. We knew it could happen.
I was devastated. I think the senior staff were naturally devastated. We were a little army, you know, and making sure that we were protecting everybody.
She was heartbroken, actually. She said, oh no, you know, it's here, it's this dread that I was, you know, dreading. It's now here. The staff, you know, are worried.
Across MHA care homes, at the worst point, almost a fifth of staff were absent, most of them isolating because of the virus. At Pennstone, the situation was even worse. More than a quarter were off, and those who remained were finding it difficult.
They were becoming very anxious about coming back in for the next set of shifts, and I had to do an awful lot of coaching and really trying to just be there for them, you know, not necessarily as the manager of Pennstone Court, but as a human being, is to try and understand and empathise, you know, how they were feeling, because it was exactly how I was feeling.
Which was what?
Frightened, scared. Worried about our own families as well, worried about taking the virus home. And then on the other hand, sort of this overwhelming feeling of we have to look after our residents, it has to happen, no matter what, no matter how frightened we are, no matter how terrible it is. You know, we commit to this job, we don't work in a shop, you know, it doesn't close. And I think everyone's commitment absolutely was shown in the end. We got through the fear together.
Marcina, now herself at risk of COVID-19, had to take the decision she'd been dreading: to move her son in with her parents. When we met, they'd been living apart for a month.
I've had wobbles when I'm at home, because it's those times that affect me more, because I have nobody to take care of. Miss those snuggles at night. Yeah, I've had the thought of why am I doing this? And then I'll get a text from Lisa or a phone call and I think, yeah, this is why I'm doing this. This is what it's about, and we'll get through this.
When Newsnight was here before all this began, residents shared their fears of what might come. Those we met have come through. Around a third of the home's residents had symptoms but recovered. Sadly, they've lost 2 friends.
We're all still grieving for the residents that we lost. It's very, very fresh and very, very raw for us all as a team.
One of them was 99-year-old Margaret.
She was due to be 100 on the 13th of May. She was the life and soul of the home. We promised her a party. She was really looking forward to that party. You know, being 100 is a huge milestone, and she really wanted that telegram from the Queen. What we did to honour her yesterday was we got her name on the balloons with white feathers in. Chef made a special cake for her 100th birthday, and then we sang happy birthday, of course, but that was really, really tough, really, really hard to do that.
A round of testing of all care home staff and residents is now underway as part of the government's home testing promise. MHA have shared their results with Newsnight. 675 residents, or 13% of the total, recently tested positive. Nearly 45% of them were asymptomatic. 426 staff members, around 7%, have also tested positive. 42% of them were not displaying symptoms of COVID-19.
We've just wanted the tools to be able to manage this situation in our homes more effectively, because there will have been some staff that probably had it that didn't know. And if we could have known, we would obviously have not had them in the workplace. You would never knowingly, ever knowingly do that.
I think we've massively been let down by the government. They haven't put measures into place for people in care homes. How we want and need those tests, on a regular basis to ensure the safety of the residents, because they are the most vulnerable.
We'll keep working to strengthen the protective ring that we've cast around all our care homes.
There isn't a ring of steel around care homes. We haven't got the testing routinised and in place yet. We've got an insecure and inconsistent pipeline of PPE. We haven't got a united front in terms of health and social care yet.
It's an insult to our carers. They are the people who have gone in, day out. They've gone into a risky situation. They've looked after people with the virus. They've seen many of the residents pass away, and they really do care for those residents. And for government to say that they've put their arm around and protected is just an insult.
Pennstone's outbreak is over, for now at least. Like all staff and residents, Marcina had a negative test. She's taken holiday and has been reunited with her son. MHA is celebrating its residents who have beaten the virus. 930 have recovered from either suspected or confirmed COVID-19. Each recovery is a moment to savour.
It's a phenomenal experience in our homes when they start to see the number of people no longer dying, but the number of people recovering. And we've had amazing instances of where somebody who was 100 contracted it, went into hospital in the end because she was so acute, survived, came back out and came back into the home. And you're going, go girl, that's just amazing.
But as of today, the charity's toll has been heavy. They've lost 398 residents in their care homes to either confirmed or suspected COVID-19. 3 staff members have also died, and 90% of their homes have had confirmed or suspected cases. Carol lives at Heather Grange in Burnley, where the outbreak started all those months ago. She lost her best friend in the home, Iris.
She would call her Iris.
You must be missing her.
Oh, yes, lovely. We had some fun. Really did. There's people you get used to when you get talking to them, they pop off. They pop the clogs.
I hope that any public inquiry bears testament to the real impact that there has been on the care home sector. This has been a sector which has been deprived of its voice and marginalised through this pandemic.
Do you think you did do enough to protect Lynn and others?
They'd got all the PPE they needed at all our homes. We hadn't got the testing in place. But you wonder if so much of your energy is having to go into these fights to get the things that you know are no-brainers in terms of what you need. And you wrestle on an ongoing basis with, could we have done more? Could we have shouted more? Could we have battered the door down more about testing and PPE? And what difference would it have made in the face of something that is still like a permeating mist that's creeping around the place?
MHA accepts the government's been dealing with huge challenges, but the toll of this on residents and staff leads them to one conclusion: that had different decisions been made and had their residents' lives been fully valued, fewer may have died.
The residents in our homes, you know, they have been veterans. They are a Captain Tom. You know, they've been nurses, they've worked, we've got one lady who's Churchill's secretary. The people that have given this country their lives, some of them, and they are and they deserve to be treated with respect and dignity for all that they've given to the country, all their lives, day in and day out, and I just feel that they are lost, they are forgotten.
MHA's seen more than twice as many residents die in their care homes in these past months compared with normal times. Those deaths, they say, must not be in vain. In the reckoning that may come, They want social care brought in from the margins, with proper reform and financial support. A settlement that values staff and enables people nearing the end still to live the best lives they can.
Katie Razzall. We asked the government for an interview. Nobody was available. The Department for Health and Social Care said our priority is to ensure care workers and those receiving care are protected. The latest statistics show over 60% of care homes have had no outbreak at all. We've set out a comprehensive support package for residents and staff, including a £600 million infection control fund, testing regardless of whether you have symptoms, and a named clinical lead to support every care home. We recognise more must continue to be done and have made £3.2 billion available to local authorities to address additional pressures from coronavirus. The department also told us that it has always provided